The first question, how to encourage those who are depressed and how to speak to them if they are unbelievers. Actually, one thing that we need to understand is that when we see people, of course we all see people who are discouraged and depressed all around us, and we can have a listening heart to them. We can listen to them, allow them to ventilate their feelings as much as we have time and resources. We can encourage them to vent out their feelings and what they are going through, and listen to what they are seeing, and have a empathetic attitude. We say empathy means ability to feel the other person's feelings. Of course, Jesus only has perfect empathy. Jesus only can perfectly feel what we are going through. He can perfectly sympathize with our weaknesses, Hebrews 4:15 says. But as we draw closer and closer to the Lord can help us to sympathize and empathize. Sympathy means suffer with, empathy means suffer in that person. Pathos means suffering, and pathos means suffer in that place, being in another's shoes. So I imagine, Lord, if I was in that particular person's place, how that person would be feeling, and I'm able to empathize with him, and then I would be able to listen to him more, and the other persons also would be able to sense our empathetic feeling. When we are empathetically listening, they would be able to sense that, oh, this person cares for me, and so then they would, especially even if they are unbelievers, actually, as somebody said, no one cares how much you know till they know how much you care. You understood? No one cares how much you know, how much knowledge you have. No one cares unless they know how much you care for them. Just like Joseph in the prison, when he saw that cupbearer gloomy, he was asking what happened. So like that, we can strike a conversation with them. How are they? And we can listen to them, have an empathetic attitude, and be non-judgmental towards them. We do not know what their circumstances about, how their childhood traumatic experiences, and so many things that we may not perfectly understand as a human being. So be non-judgmental. Don't criticize or condemn them, but be with them. And if you feel that that their symptoms are very pervasive and very severe, that is affecting their sleep and their daily routine of life, and of course taking some professional help, good psychotherapy, and good medicines also, very safe, effective medicines are also there, which can help them to come out of that quicker and more smoother. And also, one more thing I was trying to say was that especially if they are unbelievers, according to the receptiveness, we can tell them about the Lord and our testimony. And if they are very unreceptive, we shouldn't force anybody to anything. But actually, if they are receptive, we can say from our life how the Lord encouraged us, and some Bible verses which encouraged us. If they are more receptive, we can tell them about the Lord and the gospel, and how they can receive Jesus into their life, which can make all the differences. And so like that, we will be able to help them and guide them and be with them and support them in whatever way we can practically. And if we ourselves are not able to do that, we can guide them to even our church elders or other uncles and aunties in the church, or some other some reliable person whom we can entrust them to, and who can shepherd them better than us if we ourselves are unable to do that.